CHEPS is contact heat evoked potential stimulation, and it's a new technique that we're using to look at the small diameter nerve fibers of the body. Those are the ones that give us information about pain and temperature in the environment. Up until a few years ago, we didn't really have any techniques to look at this system. We could only look at the large diameter fibers that control muscle movement and knowledge of where a limb is in space, for instance. So the CHEPS allow us to look at these small diameter nerve fibers, and is particularly useful in conditions that are affected with small fiber nerve damage or small fiber neuropathy, like diabetes, which is quite common. Well, prior to the CHEPS technique, we really didn't have any objective test looking at these small diameter nerve fibers that convey pain and temperature. So it was more of a matter of asking people, can you feel this pin poking your toe or your finger, and recording yes or no, and that was about as sophisticated as we had it. Well, CHEPS is a device. It's a console, 1.5 feet across and deep, maybe 3 feet tall, and it has connected to it a metal foil electrode that rests on the skin. And that is connected to a reservoir in the console, and it, via a computer, it is able to give a very short spike of heat that lasts only a second or two, and it feels like you're getting poked on the skin with a little pin. And then that information is conveyed from the skin to the nervous system into the brain, and we can record a blip over the brain, and it has certain characteristics. So for instance, it's tall in normal people, and it's short or gone in people who have nerve damage. Also, it can be slowed down. The information doesn't get there on time in people with nerve damage, such as diabetic neuropathy, for instance. Well, the importance is that until this point, we haven't really had an objective method to study these small diameter nerve fibers. So now we have that kind of tool available, and we're beginning to see how that works in normal people, and then we can look at it in people with nerve disease and compare the two. And we can follow people with nerve disease to see how their CHEPS responses progress over time. So we're thinking of using it in clinical research to evaluate treatments for nerve damage and neuropathy, and also to study the anatomy of the pathways for pain in the body. The study that we just did, and we're presenting later this year, looked at the velocity of these responses from the time that the spike of heat is given on the skin till it is recorded and registered over the brain. And right now we're in the process of collecting normal values. What is the normal length of time it takes to get from the skin to the brain? And how big should the blip be? And once we figure out what is normal, then we'll be able to look at people who have various nerve disorders and diseases and decide if they're not normal. Well, for patients, it means now we're developing another tool in our arsenal to study and help people with nerve damage, like people with diabetic neuropathy. Mm-hmm. And now we have more objective data that can document, yes, there is trouble with this nerve fiber pathway in the body, whereas before it was very subjective. So this is a step forward in this field. The significance for the medical community is now we have another instrument, another tool that we can use to determine what kinds of troubles people have with disease in the nervous system. So this is expanding our diagnostic abilities. That will probably be a little while, maybe 2 or 3 years. We have a number of studies underway that are collecting information, and once those studies are completed and we analyze the results, then we'll be able to determine whether this technique is of general use and might be applicable to patients worldwide.